This week we wanted to talk about the advantages of using antibiotics. Joining us as always is Dr. Bruce Goeringer. Dr. Goeringer, pleasure having you on the show again.
Good to see you too again, Dave.
All right, so antibiotics in dentistry, you may have infections that develop in your mouth, and that's just one of the reasons why you want to use antibiotics.
Yes, if you have a situation where you develop an infection, you develop pain, a lot of times we'll prescribe an antibiotic to eliminate, well, to at least control the pain for a period of time until we can actually get you in the office to see you. So we'll prescribe the antibiotic. That'll reduce the infection, reduce the pressure, and you'll feel less pain, so that when you do come in to have the treatment done, it'll be much more comfortable.
Now, how do these antibiotics work in terms of virus?
Well, antibiotics are not functional against the virus. Sometimes we'll give an antibiotic in a situation where you may have a virus, but we do that to prevent a superinfection with the bacteria. Antibiotics are effective against bacteria, but not against viruses.
And with antibiotics, often you say, as you mentioned with the superinfection, they're kind of preventative because they can lead to other problems, these infections, if you don't take care of them.
Well, some of the things that we use antibiotics for, if a person comes in with a heart valve replacement or a heart murmur, a lot of times their physician will suggest we use an antibiotic so that we can prevent bacteria that might get into the bloodstream and cause problems with their heart valves. So people that have that situation, we will prescribe an antibiotic prophylactically, and they will take it an hour before the appointment, and then they'll be protected against this bacteria that might be generated when we actually do a dental procedure. And that way those heart valves will stay healthy as they should.
Yeah, that's something that you wouldn't necessarily think of, that you would need antibiotics and for dentistry for things that have to deal with your heart. Now, as far as allergies and penicillin, what's the tie-in there?
Well, a lot of people have penicillin allergies, and we have alternative antibiotics that we use for people in that situation. There's several that we can use so that if they have multiple allergies, we can use other antibiotics. Erythromycin is one that we frequently use. We used to use tetracycline. That's not used as much anymore because we have more effective antibiotics. We have clindamycin, which is a powerful antibiotic, and we also have azithromycin, which is, people might be familiar with the Z-Pak. That's azithromycin, and we use that frequently too, to pre-medicate patients and for patients who are allergic to penicillin.
Doctor, tell us a little bit more about your practice. It's located in Dallas, Goeringer Family Dentistry. You do all types of dentistry.
I'm a general dentist. I do all phases of dentistry, root canals, dentures. I replace missing teeth. I do, of course, bonded restorations. I do silver fillings. We still do silver fillings when they're necessary. We restore teeth. Any oral infection, we would treat that as well.
And for our viewers that would like more information from you or perhaps want to schedule an appointment, how can they do that?
Well, they could call my office at 570-675-3646, or they can get on the website, which is drgoeringer.com, and they can get all the information they need there.
All right, Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. As always, pleasure having you on the show.
Good to see you again, Dave.
Our style guide, Paul Nardone, is back today, and he is taking us from shabby to chic with one can of spray. That's coming up next. He's making the old look new again with a can of spray paint. Don't miss that. And it's Tuesday, so it's time to try out another As Seen on TV product. We're putting the Shoedini, the telescoping shoe horn, to the Tuesday tryout test.